The American healthcare system is in a state of crisis. For many families, premiums have become their single largest expense, often surpassing their mortgage payments. Since the early 2000s, premiums have skyrocketed, leaving self-employed professionals and small business owners feeling trapped. But there is another way. Today, we're following the Smiths, a hypothetical family of four, as they navigate 6 months outside the traditional insurance system. On day one, the Smiths faced a choice: continue paying $1,200 a month for insurance, or switch to a health-sharing ministry for just $500. They chose health-sharing. But unlike insurance, their $500 isn't a premium. It's a monthly share that goes directly to help other members with their bills. Onboarding isn't automatic. The Smiths had to agree to lifestyle guidelines and understand that health sharing is a community of like-minded individuals sharing a common set of values. This community pooling logic is the engine of health sharing. It's about people helping people, bypassing the massive overhead of traditional insurance companies. Just 2 weeks in, the system was tested. Their son Joey went down during a soccer game with a painful ankle injury. The Smiths rushed to a local urgent care center. Because they were self-pay patients, they weren't restricted by insurance networks. The final bill was $450. Under their old insurance plan, this wouldn't even have touched their $5,000 deductible. The Smiths simply snapped a photo of the bill and uploaded it to their member portal. The process was transparent and surprisingly fast. Members like David, a self-employed contractor, report similar experiences. He saved $15,000 in just 2 years after ditching his high-premium plan. Sarah, a freelance designer, says the simplicity and fairness of the community sharing model gave her family the peace of mind they were looking for. By month 3, it was time for routine checkups. This is another area where health sharing differs significantly from the insurance world. The Smiths had a $300 routine visit. By identifying as self-pay patients, they were able to negotiate a prompt pay discount at the front desk. Many members pair their sharing plan with an MEC plan to cover preventative care, doctor visits, and labs, creating a powerful dual strategy for health and wealth. But what happens when disaster strikes? We use what we call the billionaire test to vet a program's financial stability and claims history before recommending it. Month 5 brought a major challenge. A serious car accident sent Mr. Smith to the emergency room with a $2,500 bill. In the insurance world, this would trigger a months-long cycle of denials and adjustments. In health sharing, the process is streamlined based on clear community guidelines. Because the Smiths hadn't met their $5,000 deductible, insurance would have covered nothing. But with their health share, they only paid their $1,250 PRA. The remaining balance of $1,250 was shared by the community. Mr. Smith was able to focus on recovery, not medical debt. The pros are compelling. Costs are typically 50% lower, and you have the freedom to choose any doctor or hospital you want. But we focus on facts, not hype. Health sharing is not insurance. There is no legal guarantee of payment, and pre-existing condition rules can be strict. Many programs have a 3-year look-back period. If you have a chronic condition, you must understand how waiting periods will affect your ability to share those specific costs. Transparency is the lifeblood of a healthy ministry. Always read the member guidelines carefully before joining. Know exactly what is and isn't shared. Legally, health-sharing ministries are exempt from the Affordable Care Act's mandates. This is why they can price based on risk and lifestyle, unlike the marketplace. Insurance is a contract with a guarantee. Health sharing is a voluntary agreement among community members. It's a subtle but critical legal distinction. Let's recap what we've seen so far. The Smiths faced an urgent care visit, routine checkups, and a major ER event, all while saving thousands. At month 5, the gap between traditional insurance and health sharing was already massive, but the finale is where the true impact is revealed. Now let's look at the full 6-month picture. We've tallied every premium, every share, and every out-of-pocket medical expense. Under traditional insurance, the Smiths would have paid over $7,000 in premiums and $3,000 in medical bills, a total of $10,450. With health sharing, their total cost was only $4,500. That includes their monthly shares and all out-of-pocket costs for the ankle and the ER. That is a staggering savings of nearly $6,000 in just half a year. For a family like the Smiths, that's life-changing money. Health sharing isn't for everyone. It requires discipline and thorough research. We encourage you to audit your life against the guidelines before making the switch. If you found this case study helpful, subscribe to the HealthShare Guide. Comment below with your questions or share your own experiences. Let's keep the conversation going. This video was brought to you by Clear Choice Health Insurance. Visit cc-healthinsurance.com to learn more about your options. Thanks for watching.